Thanks very much, Dr. Chan. Look, I just want to emphasise that this virus is it's only mobile, it's only moving around if people are moving around. That's why we have asked for people to stay at home. In fact, the health orders direct us all to stay at home and only to leave in particular circumstances. So I stress that if we can stay in our homes and not move around, the virus won't move around, it won't be transmitted to others in the community. I also want to just emphasise to the community that one of the reasons, obviously, you can leave home is if you are unable to work from home. So if you have to go to a workplace to do your work, well, that is an allowed exemption. But I certainly want you to be talking to your employer, because if you work with your employer, it may be that there can be other arrangements in place. These days, most employers would have capacity in an office environment anyway to be able to facilitate you working at home. I stress that if you can have that discussion with your employer, that would be very helpful, because we all have this role. We all have a duty. Your employer has a duty, you have a duty to try and stop this virus moving around and being mobile amongst us. I also want to emphasise to employers, I think there's been a little bit of perhaps confusion with the employers. I've heard that some employers are telling employees they must come into the office, they think they really need them there. Well, I'm just going to emphasise to the employers throughout New South Wales, we're all in this together. Please understand there actually is a health order requiring you to allow your workers to work from home unless they really can't. But it's not really the order, is it, in the end? It's what we can all do. So I just ask the employers to think about that one, and to just make sure that you are talking to your employees about arranging for them to stay at home and to work at home, if at all possible. As the Premier said, and as Dr. Chan has said, everybody's doing a really good job in New South Wales at the moment. We've seen obviously the numbers, the broader numbers come down, but there's still levels of concern about particular people going out, particularly going to pharmacies and other places. You've got to stay home. If you have any symptoms, you've got to stay at home. If we can just get everybody to stay at home as much as is humanly possible, irrespective of the orders, just stay at home unless you really need to go to work, that would be helpful. But employers, definitely take that on board, please, and work with your staff to allow them to stay at home. Facilitate them staying at home if at all possible. Thank you.